Hello everyone, this is Shinuja, Assistant Professor, Department of Biotechnology, St. Joseph College of Arts and Science for Women, Osur. Today's topic is non-invasive prenatal technique. Non-invasive prenatal technique is a screening test offered during pregnancy to see if the fetus is at risk for having a chromosomal disorder like Down syndrome, that is trisomy 21, and trisomy 18, that is Edwards syndrome, and trisomy 13, that is Patau syndrome. It's done by taking a sample of your blood, which also contain fragment of DNA from the fetus. DNA makes up a person's genes and chromosomes and gives healthcare providers a glimpse into the fetus' genital makeup. Non-invasive diagnostic methods include methods that employ ultrasonic waves such as the ultrasound and the Doppler examination, which can be safely used at any time during the pregnancy through delivery. The first one is ultrasound. This is a non-invasive procedure that is harmless to both fetus and the mother. A prenatal ultrasound, that is sonogram, is a test during pregnancy that checks on the health and development of your baby. An ultrasound or echography uses ultrasonography or sound waves as a diagnostic tool. An ultrasound sends waves to the fetus that bounce off internal fetal structure. During an ultrasound, sound waves are sent through your abdomen or vagina by a device called transducer. Internal and external malformations can be diagnosed based on different tissue densities. A prenatal ultrasound does two things: evaluate the overall health, growth, and development of the fetus, detect certain complications and medical conditions related to pregnancy. Uses of ultrasound test: confirm pregnancy, check for ectopic pregnancy, moral pregnancy, miscarriage, or other early pregnancy complications. Determine baby's gestational age and due date also. Check baby's growth, movement, and heart rate. Look for multiple babies, twins, triplets, or more. Examine pelvic organs like uterus, ovaries, and cervix. It is used to examine how much amniotic fluids have. Check the location of the placenta and check baby's position in uterus. It also detects problems with baby's organs, muscles, or bones. Prenatal ultrasounds are typically performed as various stages of pregnancy. First trimester, often done between 6 to 12 weeks to confirm pregnancy. Determine the gestational age and screen for certain chromosomal abnormalities like Down syndrome. Second trimester, usually performed between 18 to 22 weeks for a detailed anatomy scan, assessing the fetus growth and development and detecting structural abnormalities. Third trimester, sometimes conducted if there are specific concern or if conditional monitoring is needed. Doppler ultrasound. A Doppler also uses sound waves as a diagnostic tool, but the waves are sent to the fetal blood instead, allowing us to study the placental flow and the fetal circulation system. A Doppler ultrasound may help diagnose many conditions, including it shows whether a pulse is present and whether there is blood flow to a limb. It can diagnose or help to manage conditions such as peripheral arterial disease or diabetic foot ulcer. Blood clots also detected by Doppler ultrasound. Poorly functioning valves in your leg vein which can cause blood or other fluid to pool in your legs, known as venous insufficiency. Heart valve defects and congenital heart diseases also detected by this technique. Maternal serum screening. Maternal serum screening involves analyzing a pregnant woman's blood to assess the risk of certain chromosomal abnormalities such as Down syndrome in the fetus. The test measure the level of various markers such as alpha fetoprotein, human chronic gonadotrophin, and unconjugated estriol. Thank you.